I'm really excited about this next patient. His name is Ron. I've known Ron for 10 years now, and we've even named 2 lights in the clinic after Ron. But we only have 1 room, so we're in Ron's original light room. Ron used to be a Cabana Boy in Hawaii and has had multiple skin cancers. And he asked me at one point in time, "Doc, you've treated me so many times, have I paid for those expensive lights that you bought?" And I said, "Well, you know, Ron, actually, you have." And I said, "What would you like me to name the lights?" He says, "How about Ron's light?" So we have Ron's light in this room and Ron's other light in the other room. So my friend and my favorite patient.
Duke was, he was down there several times on the beach with me. He was past the age of being working on the beach, but he was down there, and I knew his brother, and all those beach boys that I work with are probably all gone right now.
Ron! Hey, welcome back.
Oh, hey, I'm always coming back.
Yeah, that's true. What brings you in today?
You got to look at my back and check my forehead. I know I got some precancerous things on my back.
Sure. I know that we've done, 3 melanomas and 17 skin cancers in addition to that, and multiple freezings, too many to count.
Yes, indeed.
Have you been taking the niacinamide vitamin that we talked about?
Yes, and I do like that.
All right, great.
I really do.
Yeah, so the niacinamide has been shown to decrease precancers for people with a skin cancer history, 500 milligrams twice a day.
Well, I notice it cleans up my face.
Yeah, that's fantastic.
It is really good.
Yeah, there was a study out of Australia, and so we're recommending that for people like yourself.
Yeah. Well, that works for me.
All right. I'm going to clean off my hands, and we'll see what you have. So we can see here on Ron's back that there's a couple red scaly spots, and these are not yet skin cancers. These are precancers. So if they were skin cancers, I would biopsy them. But looking at them under the microscope, they look red and irritated, and that's a precancerous condition. He's got a couple throughout the back. There are these brown, waxy, stuck-on spots that I see, sort of like teardrops falling down his back. And these are all harmless growths. You know, with Ron's melanoma history, we need to be a little bit more cautious. But all of the spots I see look harmless to me in terms of them not being melanoma. Yeah. So I'm just going to start freezing these on your back, the ones that are precancerous.
Can you explain how that can freeze something so fast?
Yeah, so this is liquid nitrogen. It's minus 195 degrees in the can, and it's minus 45 degrees on the skin. And what it does is it creates a tiny little frostbite in the area that's treated. And in doing that, we can get rid of the bad cells, and they heal up with good fresh skin underneath.
My job is to say ouch.
Let me see this arm. Sometimes you can feel them better than you can see them, and they just light up when they're treated. These blue-red spots, those are ecchymoses. They're deep bruises in the skin. As we age, our skin gets thinner. Go figure, right? Well, actually, Ron, okay, you can drop your arms. Do you think being in the sun had anything to do with what you're dealing with now?
And being light complected, too.
So, NUO, right chest. So, Ron, as I'm looking at you and looking at you more closely, there is this one spot on your right chest. So we'll have you turn this way.
Okay.
And I'll have you hold that. And you can see this spot here. It's red, it's pearly. There's some telangiectasia or blood vessels throughout it. And I'm concerned that this may be a skin cancer.
I think it is.
Yeah, so one of the reasons I wanted you to come in and to film it is because knowing you and knowing our history together, it seems like there's every visit you come in that we find another one.
I know.
So this one we'll biopsy today.
Okay.
If that's okay with you.
Fine.
Well, Ron, I think Dr. Greenberg's right. It looks like you did it again. You went and you grew a new skin cancer, unfortunately. But, you know, you're in great hands with Dr. Greenberg.
Of course.
Yes. And so the reason I wanted you to come in is I just wanted to get an idea of how you think you would approach what looks to me like a basal cell. Now, we'll do a shaved biopsy on this, and the goal would be to get the roots and get the sides, but it's still possible that it may not all be gone with the biopsy.
Well, absolutely. I mean, generally for a basal cell skin cancer, standard of care is to cut it out and sew it up. But I know that every patient is different, and when you've had 17 skin cancers already, sometimes less is more.
I'm used to it.
I think Ron's preference when it comes to these things is to just have it cut out and sewn up right away.
Absolutely.
Yeah.
Yeah.
You're done. Put it to rest.
Dr. Connor always teases me. I'm a huge Aldera fan. I think it's the greatest medicine, but not today. I like the double-edged razor blade because I think it's the sharpest tool that we have in the clinic. All right. So the biopsy has been performed. Now I'll hypercate the base. I always like to dispose of my sharps immediately. I went to medical school in Detroit, and they would tell us that if you don't dispose of the sharps, we will stick you with them. So it was fantastic incentive to dispose of the sharps immediately. You have your Band-Aid. We're done.
I'm good to go.
Good to go. We'll lower you down. So today I'm going to clean it off. I'm going to mark it, and then I'm going to cut. I'm going to numb it, and then I'm going to cut around it.
Thank you very much.
Yeah, I know you enjoy the numbing part. So, do you have any questions? You've been here before.
No, I've done this before.
Okay. So let's get ready. And we're just taking a margin of safety around it. So
Good.
yeah. So I'm going to numb it now.
Thank you.
Yes, sir.
Appreciate that.
And I use lidocaine with epinephrine, and we buffer it with sodium bicarbonate to take away the sting. You'll feel a prick and a burn, and then you shouldn't feel anything after that. I always follow along the trail. So we're going to incise down to the superficial fat. That'll be in an area that helps us get to right under where the tumor should be, following the lines that were already marked before I did the numbing. So this is a nice little ellipse, very straightforward. And we've done so many procedures, Ron and I, together, that Ron has actually paid for the light under which he is being operated. You okay, Ron?
Yeah, I don't feel a thing.
That's perfect. So we can see the fat here, gone through the dermis. So we have our specimen now. So this is a hypercator. It stops the bleeding. So there's some pinpoint bleeding, which is normal. We've cut your skin. It will dissolve, and we're going to use the same material on top. Okay. I feel more comfortable doing surgery than I do even driving a car. We've done so many of these.
Well, it comes out beautiful.
Yeah. But, you know, it's a peaceful place to be in here because there's not any distraction. It's just you, me, and the 20 camera people. Mm-hmm. So you can see how, you know, the wound is come together. How does it feel to be cancer-free, Ron?
It feels pretty good.
Yeah.
I'll grow some new ones though for you. I'll keep you in business.
I appreciate that. Thank
I
you.
know.
Thank you. Yeah, we need some more equipment.
You might need some more lights. I'll work it in my schedule.
Hey, Ron, how are you?
Fine.
Welcome back. How does the surgical site look?
It's beautiful.
Any problems with it?
No.
All right. Well, it looks pretty nice. I'm impressed. You're doing a good job taking care of it. The surgical scar looks really nice and tight. There's a little bit of crusting there. I'm gonna clean off the crusts.
Okay.
Is that all right? Okay. Any other issues today?
No.
Anything for me to freeze?
No.
Any more spots for me to biopsy?
I hope not.
I hope not too. All right. First, let's clean your crusty bits. Fell right side. You're good. So what this does is it's hydrogen peroxide. It removes the scabby, crusty bits.
Okay.
And wounds tend to heal better in a moist environment. Certain, but it does look really, really good. So I am pleased with how well you've healed. I'll put a little Band-Aid on there. And then I'm gonna take a look at the rest of you. Make sure there's nothing